Tonight on The New Reality.
Things have really accelerated with Wave 2. I would be lying if I said I wasn't tired.
A pandemic that started 10 months ago as a sprint is now a marathon.
So half the ICU right now is COVID. They're all on life support in one way or the other.
How worried are you about going into Christmas and what might be waiting for us on the other side of that?
Very. Like unequivocally, very.
For us, nothing has stopped. Babies don't wait for pandemics to finish.
The maternity ward at this hospital has its hands full.
I'm pregnant, I have COVID, and I'm about to give birth. What's gonna happen?
The following are a list of things that we will or will not do once this pandemic is done. And yes, one day this pandemic will be done.
Hello and welcome to The New Reality. I'm Donna Friesen. It's been almost a year since the World Health Organization first reported a cluster of cases of a mysterious illness in Wuhan, China. Days later, a new virus was identified, and what no one knew then is how all-consuming COVID-19 would become. It has changed everything. Lives lost and livelihoods destroyed. It's hoped vaccines will eventually wipe it out, but for now the virus is still winning. Tonight, Jeff Semple goes back to the front line, back inside the COVID ward at Humber River Hospital.
As COVID-19 cases climb, hospitals in Ontario have been ordered to prepare for a surge. Some postponing surgeries to make room for the second wave of patients. But there are some procedures that simply won't wait.
For us, nothing has stopped. Babies don't wait for pandemics to finish.
The maternity ward at this Toronto hospital has its hands full, delivering Corona babies, as they're now affectionately nicknamed, a new generation born into a pandemic.
This situation for patients is a very happy one, but a very nerve-wracking one. So adding the pandemic on top of that for people has been very challenging.
Daniela Comprera is an OB-GYN at Humber River Hospital. It's located smack in the middle of one of the hardest hit neighborhoods in the country, and its staff aren't taking any chances.
I'm going to go this way, okay?
When pregnant patients arrive, even before the delivery room, they're tested for COVID-19, including those without symptoms. And the result can make an already scary situation downright terrifying.
Oh, it was shocking.
Just days before her due date, Alexandra Abril tested positive for COVID-19.
Now I'm pregnant, I have COVID, and I'm at the end of my term, and I'm about to give birth. What's gonna happen?
5 seconds, super fast.
Abril's 3-year-old son Elijah also tested positive, and so did her husband, which meant he had to quarantine away from his family and wasn't allowed in the delivery room.
It was tough, and not knowing when I'll be able to see them.
On Abril's final day of quarantine, her daughter was born. As a precaution, the infant was also tested for the novel coronavirus, enduring 2 swabs in her tiny nostrils. Fortunately, the baby's results came back negative.
Her dad hasn't met her yet. Her other grandma has only seen her through a window. So it's very, very different experience. And it's sad, but at the same time, I know health-wise, and I don't want them to get sick, especially my newborn baby.
During the first wave of the pandemic, Abril's diagnosis would have shaken hospital staff. Infected mothers in some hospitals were kept away from their newborns for up to 2 weeks.
There was definitely a lot more panic just because we didn't know as much about the virus.
But the evidence now shows the virus isn't spread through breastfeeding, and babies have proved remarkably resilient.
I think as long as mom uses the proper precautions, then, keeping mom and baby together are the most important thing.
The first time we were here in Toronto's Humber River Hospital was back in the spring during the height of the first wave. And what a difference 10 months can make. The hospital looks, even feels different. Staff sounding a lot more confident, and for good reason.
We're far more prepared on wave 2, and so you don't actually feel the same level of stress and anxiety.
The head of emergency, Leon Rivlin, says a big part of that preparation is protection, PPE. In the early days of the pandemic, staff struggled with a shortage. Masks had to be signed out and carefully conserved, but no longer. Today, they're both better equipped and better informed.
We've learned a lot about the transmission of the virus. That's why you see me wearing a face, like a visor covering my face, and a mask. Because even with our 3-ply masks, there's still a little bit of viral transmission.
Hi, I'm Dr. Nimji. I'm going to scooch in here. What's that? Not much. How are you?
We first met Dr. Tasleem Nimji back in March. The ER physician in charge of the hospital's pandemic response was worried about herself and her staff becoming infected and bringing the virus home to their families.
We're here putting ourselves in harm's way for our patients, which we are happy and proud to do.
But thankfully, those fears haven't materialized. In this hospital, staff haven't gotten sick, says CEO Barb Collins.
We've had some transmission, but the transmission has not occurred in the hospital. For the most part, largely the staff who have become ill have picked it up outside.
Outside, in the Toronto area, COVID-19 cases have climbed to record highs. The start of the second wave saw mostly younger patients, but Nimji says those demographics are changing before her eyes.
And so it was a matter of time for it to shift into that older population.
Including a growing number of middle-aged patients in their 40s and 50s.
It completely changed my life.
This 53-year-old has no underlying health conditions, but says she woke up struggling to breathe.
Feel sick, weak, short of breath. It's been really hard for me and my family.
As cases climb again, staff are worrying less about infection than exhaustion. A pandemic that started 10 months ago as a sprint is now a marathon.
I mean, on a personal note, like, how are you doing? I mean, how are you feeling at this point?
Thanks for asking. I would be lying if I said I wasn't tired. Especially now as things have really accelerated with wave 2. It's not a 5-day-a-week job. It's again a 7-day-a-week job, and so fatigued, but hopeful because we have to be hopeful.
Ticket R004. It does wear on you because it never goes away, right? And each day brings a new potential COVID outbreak.
Dr. Michael Gardam is no stranger to the pressures of a public health emergency. He was on the front lines of the SARS outbreak in 2003.
If there's lots of virus in the room, got caught with their pants. Certainly if you have a lot of cases of flu out there.
Has given countless media interviews and held a number of leadership positions, providing a calm hand in the storm.
You know, I still have a bit of PTSD post-SARS. And then there was the concerns with H1N1 in 2009. And then there were concerns a few years ago about, Ebola virus coming to Canada. There was so much fear. And when you're the person who's advising on what to do and you're in all those meetings and you're speaking to people in the media and you're getting hit with these waves of fear, that is exhausting.
There is an unprecedented outbreak of Ebola virus occurring in West Africa. And then to draw a very clear distinction between what's happening there and what could happen here in Canada.
You're trying to walk that line between, I want you to be noticing this, I want you to be somewhat concerned about this, but I don't want you to panic about this. And it's often very hard to walk that line.
So this is our COVID-19 tile.
During the first wave of COVID-19, Gardam was chief of staff at Humber River Hospital. And while he was saving lives, the pandemic nearly claimed his own, but not from the virus. During a hospital shift back in May, Gardam suddenly felt a pain in his chest.
As a physician, you spend your first 10 minutes running through a list of things that this could be in your head and then thinking, this can't possibly be cardiac.
But as he stumbled into the emergency ward, he realized that's exactly what it was. Gardam was having a heart attack, caused by a blockage in his left anterior descending artery, morbidly nicknamed the Widowmaker.
Talk about access to healthcare, right? You know, I had a heart attack in the hospital, and then, you know, they treated me extremely quickly. The day before, I was at my farm in Prince Edward County. If it would have happened the day before, I wouldn't be here.
Now, 7 months later, Gardam, a former marathoner, has made a full recovery and a life change. In October, he, his partner, and their dogs packed up and moved out of the big city to the ocean on Prince Edward Island.
The level of chronic stress and anxiety, which I think was compounded with the pandemic, that was like a major wake-up call for me. And I felt at that point I needed to change gears in what I was doing.
He's still working full-time, but like many of us these days, he's doing more of his work remotely. At 56, he says he has no interest in retiring, and this is no time to back away from a fight.
I know that there's been some pushback about using war analogies. You know, the way I look at it is that it's kind of like we're in 1944 right now. You sort of think that you can see an end to this, but it's not going to happen tomorrow, and we've got months of slog to get there, and you can't stop. If you stop, you're going to lose all of the things that you fought so hard to win.
And back on the front lines, he says the greatest threat to that victory is COVID fatigue and Christmas.
How worried are you about going into Christmas and what might be waiting for us on the other side of that?
Very. Like unequivocally, very.
Coming up on The New Reality.
Half the ICU right now is COVID. They're all on life support in one way or the other.
After months of battling an invisible enemy, staff have found novel ways to fight back.
The team is quite significant and each part is very important. We don't completely understand it, and I don't think we'll understand it until it's over.
Doctors point to the case of Delroy Noble.
Every night before I sleep, I look to the heavens and I pray.
After 2 months in a coma, he suddenly opened his eyes.
Welcome back. They're already exhausted, but know the second wave of COVID-19 cases will keep coming, filling up the ICU. Doctors and nurses do learn more about this virus every day and say seeing some of their sickest patients survive is what keeps them going. Here's Jeff Semple again.
After months of battling an invisible enemy, staff at Toronto's Humber River Hospital have found novel ways to fight back.
I think what we have learned is that we know how to treat it better.
Dr. Jamie Spiegelman works in the intensive care unit, where on this day, a dozen COVID patients are fighting for their lives.
So half the ICU right now is COVID. They're all on life support in one way or the other. So we're seeing outbreaks in families, and we're seeing that when family members are visiting other family members and putting those people at risk.
Because COVID-19 can attack in different ways, Spiegelman has brought backup. He's flanked by a respiratory therapist, a physiotherapist, a nutritionist, a nurse, and a social worker to help with emotional distress made worse by visitor restrictions.
So the team is quite significant and each part is very important to get these patients better.
We first met Spiegelman during the first wave back in the spring.
So it's really a very smart virus.
And witnessed a very close call. One of his COVID patients, struggling to breathe, had to be intubated, a ventilator tube inserted into their airway. But during the procedure, the patient's heart stopped.
Hey guys, meet a crash cart! Crash cart!
Spiegelman and his team performed chest compressions and ultimately saved her life.
Everything's good now. She's stable. There's a difficult intubation. Unfortunately, it happens whether you have COVID or not.
In the months since, they've learned to do things differently.
We know how to treat them better on the respirator,
including placing patients onto ventilators later or not at all. Where possible, staff are now relying on these pressurized systems, which deliver oxygen up the nose instead of a tube down the throat. This 69-year-old patient isn't getting enough oxygen, so the team performs a delicate dance. carefully flipping him onto his stomach, increasing blood oxygen and chances of survival. Patients also regularly receive steroids, such as dexamethasone, while dietitian Denise Poirier provides vitamin D and zinc.
Someone has acute respiratory distress syndrome, there are certain vitamins and minerals that are applied. But having said that, because this is such a new thing, it's a brand new virus, there's nothing scientifically proven yet that any of that nutritional component is effective.
And that remains a common refrain. Despite all they've learned about the virus, there is still much they don't know.
As I remember, you described this as a very smart virus.
It's still smart. Like, we still clearly do not understand how it works, who it affects the worst.
We don't know why some people are getting sicker than others.
We have no idea. Yeah, it's definitely multifactorial, but we don't completely understand it, and I don't think we'll understand it until it's over.
Doctors point to the case of Delroy Noble. That's him back in May, on a ventilator in a coma, just 29 years old.
I think, given his age, that he did come to us with less comorbidities.
Noble was overweight, but otherwise healthy. He'd been working as a baggage handler at Pearson Airport, where it's believed he became infected with COVID-19 back in March. Noble's mother, Marlene, was also sick, but with minor symptoms.
When I spoke with the doctors and they said, "Mom, you have a real critical son," that sinked me. But I still never give up. Every night before I sleep, I look to the heavens and I pray. So it's a lot of prayer went up for him.
Doctors didn't expect Noble would survive, but in July, after 2 months in a coma, he suddenly opened his eyes.
If you can hear me, can you blink twice?
Until they call me and tell me that your son is woken. I said, "My son, wake up." That's when I jumped. I was sitting there and I jumped here. I cried. Okay, the dinner almost finished.
I remember waking up feeling extremely tired, exhausted, body was heavy, felt lightheaded. And I knew immediately, man, I went through something rough.
And the road to recovery has also been a rough ride. Noble spent 2 months in rehab.
First, it started off small, just, moving the hands, seeing if I could move the legs and stuff like that. Then it progressed into sitting up for the first time, which was a challenge. And then eventually progressed to, standing for the first time.
His internal organs, lungs, kidneys, and liver have mostly recovered. But now, nearly 8 months since he first became sick, he still relies on a walker and leg braces when he goes outside.
I wouldn't want to go far because I get tired relatively easily.
Physically struggling, but emotionally, Noble is remarkably upbeat, playing with his nieces and showing no interest in self-pity.
I made it out in the end, so that's all that matters.
He's hopeful for a full recovery, but for now, just glad to be home with his family. And he's not the only one.
Elijah, do you want to say hi to sister?
Alexandra Abril, the mother of 2 who was diagnosed with COVID-19 just days before giving birth, is now finally home. Her 3-year-old son also recovered and just completed his quarantine. And so too has her husband. After 2 excruciating weeks apart, he's finally able to meet his newborn daughter for the first time. 2020 was a year full of terrible stories, but there were still some that managed to find their way to a happy ending. And in this case, a new beginning.
Coming up on The New Reality.
The holiday season is here. It hasn't been all bad this year, but it's been mostly bad. It's been pretty bad. But let's look forward.
Everyone will remember the holiday season of 2020, the Christmas of COVID. It's hard to be all jolly and bright when we're told we can't get together with anyone. But traditions won't just disappear. They'll just get set aside, put in a box with all your other junk in the garage, and we'll bring it all back out next year. As Stewart Reynolds, the man known as Brittlestar, reminds us, there is plenty to look forward to.
The holiday season is here. It hasn't been all bad this year, but it's been mostly bad. It's been pretty bad. Okay, if 2020 were a thing, it would be past gas in an elevator that's stuck between floors. But let's look forward. The following are a list of things, not an exhaustive list obviously, that we will or will not do once this pandemic is done. And yes, one day this pandemic will be done. We will embrace each other with only normal concern for cooties. We will gather with friends and family and initially enjoy their company tremendously, and then slowly be reminded of how annoying they are. We will sit in cafes, eat in restaurants, go to the cinema, go to concerts, walk maskless with impunity. We will not tell anyone for at least a year to be patient. We've done patient. We're very good at patient now. Patient can off. Should there be things we wish to do or places we wish to go or people we wish to see, within reason we will go to or see them, and being patient can go to hell, at least for a while. Being patient will need to just be patient. Have a taste of its own medicine. Because one day this pandemic will be over. Until then, we'll be patient.
And that is the new reality for this week. Thanks for watching.